From the food we eat, the air we breathe, the land we dwell, to the health of our body and mind and the well-being of all things in the universe. Unlock the science with Chula Radio Plus.
Welcome to Unlock the Science. I'm Lawantira Suradet. Since ancient time, plagues have always been one of the greatest threats to humanity. For many times throughout the history, fast-spreading diseases ravaged through every part of the world, killing large numbers of people on their path and causing major disruption to human civilization. Around 75 to 200 million people, or 17 to 54% of the world population in the 14th century, perished in the Black Death, a bubonic plague that is now considered the history's deadliest pandemic, according to a ranking by the Washington Post. While more recently, the Spanish flu that spread worldwide from 1918 until 1920 killed up to 50 million people, or around 2.7% of human population. As we are currently facing the global outbreak of novel coronavirus disease, COVID-19, the grim prospect of these past pandemics is not beyond comprehension of people in the contemporary society. Although the current accumulated death toll from COVID-19 is still lower than major plagues in the past, this virus has already claimed more than 4.5 million lives worldwide since the pandemic began in the early months of 2020, and by far has infected over 218 million people, or nearly 3% of the world population, according to World Health Organization or WHO. One thing that these deadly diseases share in common is they were all an emerging infectious disease of their time. According to the Centers for Disease Control and Prevention of the United States, emerging infectious diseases, or EID in short, is defined as the diseases whose incidence in humans has increases in the past 2 decades or threatens to increase in the near future. They can be either newly discovered diseases or re-emergent diseases, but the underline is these diseases are capable of spreading fairly quickly beyond national boundaries and of becoming major public and global concerns as potential causes of worldwide pandemic. We are all well aware of the colossal socio-economic impacts that the outbreak of such infectious pathogen can cause, as we are still in the middle of COVID-19 pandemic. Before December 2019, this virus was unknown to the world, but within a span of months after discovery, it rapidly transmits throughout the globe. However, it is very likely that COVID-19 will not be the last pandemic that humanity will encounter. According to an article published in the medical science journal, Nature Medicine, it has been found that there has been an increase in the emergence of new infectious diseases, as around 30 new diseases have been identified in recent decades. This is a result of the changes in human ecology, such as rural to urban migration, increasing long-distance mobility and trade, industrialization of food production, and environmental degradation, including widespread forest clearance and climate change, which bring about more intensive people-to-people and people-to-animal interactions that increase the risk of pathogen transmission. And as human-induced global changes continue to extend, so too the risk of new emerging infectious diseases in the future. Unlock the Science reporter Pratruchi Wanarom talks to Professor Dr. Thiravat Hemachudha, head of Thai Red Cross Emerging Infectious Diseases Health Science Center, Chulalongkorn Hospital, on the nature of emerging infectious diseases and how could we avoid them.
What are the main factors behind the emergence of emerging infectious disease?
On this topic, I think everyone in the world recognize that actually it's the human activities that disturb or destroy the ecology of the nature by destroying the natural resources by intruding into the wildlife territories. And then this make the wildlife to migrate to the other areas. And with these activities that transform from the originality, the virus that exists in the body of the wildlife start to mutate in order to live under the new environment. So we can call these wildlife as reservoirs. And these reservoirs can transmit the pathogens or the virus or bacteria to other species or to human as well.
And why should we concern about the emerging infectious disease?
This is a very important question because the EID or emerging infectious disease has never appeared in the world before. So human never encounter with such diseases or such pathogens. Therefore, human do not have any immunity against these viruses or bacteria. So after being infected, the virus can spread very easily, and it requires large amount of time in order for the human to develop what so-called herd immunity to act or to counter against these EID pathogens.
How much risk of the future global pandemic that we may have from the newly emerged infectious disease?
Should I say that, I mean, there might be already the EID pathogens in human, but we are not aware of. 50 to 80% of the infections in human at the hospital here in Thailand, we do not know the name of the pathogens. We do not know the name of the viruses or the name of bacteria, but we treat the patients in the way that it should be likely, or the likelihood of the pathogens, whether it is bacteria or it is the virus. So at present, we might have the EID pathogens in the humans, but we are not aware of.
So there is a lot of risks that we may face the newly emerged infectious disease in the future. Is that correct? Just like COVID-19.
It's absolutely correct. So what we have known in our knowledge is that we have at least 26 viral families, and each of the viral family member can have the potential or can be capable of evolve to become a new structure of virus. And then it can go across the barrier between species. At first, by going to another species, to animal species, such as it happened firstly in bats or birds. And then after that, it crossed the species to the terrestrial animals, that is the animals on the ground. And then after that, going to poultry, going to herds, to cow, to cattle, and then to humans. And then after that, from human to humans. And it also, depending on the route of transmission. So it may start with a close contact, which is not a very effective way of spreading. And after that, it goes to the droplet infection like we see in COVID-19. And then after that is the airborne transmission. So if the virus reached the ultimate goal of the airborne transmission, so it means that it very highly likely that the virus wins the war. And as we have seen in COVID-19, that it developed strategies of the silent transmission. So the transmission can go on unnoticeably. And then after that, once it reached a number of persons, such as 100 persons, then 10 or 20% of that 100 persons will develop illness or develop sickness. And then the sickness severity becomes escalated to be recognized and then to have a more severe disease, need hospitalization or need intensive care support. So this is the strategy of the virus from step 1 to step 10.
We will take a short break now.
You are listening to Unlock the Science on Chula Radio Plus.
In the concurrent fight against COVID-19, our main weapon against this deadly virus is vaccine. WHO has stressed that the only way for humanity to beat COVID-19 is to vaccinate more than 70% of the total population in order to create herd immunity against the virus. This is because once the vaccination goal has been achieved, there will be too few unimmunized people to widely spread the virus, so the virus will be contained and finally eliminated. The same strategy can be applied with other infectious diseases. The world had already mass vaccinated against one of the deadliest diseases, smallpox, to its eradication since 1980. However, the COVID-19 virus is proven to be trickier to be contained with vaccines, as it consistently mutates over time and develops resistance to our vaccines. Therefore, it is crucial for humans to keep up with the virus evolution. Fortunately, with the gradual advancement of medical technology, researchers worldwide are developing new techniques of vaccine production to enhance its efficiency. One of these leading researcher teams is a startup company, Baiya Phytopharm, led by Assistant Professor Dr. Suthira, Taychakhoonavudh of Department of Social and Administrative Pharmacy, Faculty of Pharmaceutical Sciences, Chulalongkorn University. She is also the Chief Executive and Co-founder of Baiya Phytopharm. Unlock the Science reporter Pratruchi Wanarom talks to Dr. Suthira on her team's vaccine development and its future prospect to be used against new emerging infectious diseases.
Could you please tell us more about the vaccine development project for COVID-19 that your team is currently working on?
Okay, so we are a biotech startup here in Bangkok, Thailand, that spin off from Faculty of Pharmaceutical Sciences at Chulalongkorn University. We have a technology platform called Baiya farming process. The Baiya farming process that we're working on is we have the technology to produce a recombinant protein. We have the facility, a GMP facilities that already done. It's already the first plant-produced vaccines and biologics facilities in Asia. With that technology platform, when there's a COVID-19, started in 2019, 2020, and the WHO announced that there's a pandemic, of COVID-19 in this world. So we in January. In February, we have a vaccine prototype that can be used to stimulate immune response. So we have that prototype. We tested in several animal models, for example, in mice, in monkeys, and then we kind of get all the results from proof of concept studies in around July. So that during that time, we were thinking last year that the results looks pretty good, and we should proceed on this vaccine candidate. On the parallel, we have our R&D team working on other non-clinical studies, like not just a few studies that we did in mice and monkeys, but we also did other studies to ensure that the vaccine that is going to get into phase 1 trial are safe and has a quality and also are effective. We are working on a vaccine that we can make, 2 variants in one jab. So maybe might be more effective in the future. Hopefully, we can have the vaccines available for the Thai people around the third quarter of 2022.
I have learned that your vaccine is the protein subunit type. Is that correct?
Yes. Our vaccine is a vaccine called protein subunit vaccine. It's that type of vaccine. So if you learn from the news, you might know that there's another promising vaccines called Novavax. Novavax is also a protein subunit vaccine, but instead of using a plant to produce their recombinant protein, they use a moth cells to produce their recombinant protein.
As right now, the environment is changing so quickly, and there is a chance that there will be a new virus, a new type of pathogen that can cause a global pandemic again. Do you think that this vaccine can be used against the also infection disease that may emerge in the future?
Yes. So of course, that's the whole reason why we make a decision to kind of, delay the progress by building our own facilities, because we know there are uncertainty of, a new pandemic coming up again in the near future. So our technology platform, it's a flexible platform to produce recombinant protein for any other diseases. For example, vaccines for other infectious diseases as well. And right now, so yeah, the question is yes. The technology itself can be used to make vaccines against other infectious disease or other newly emergent disease. But we kind of hope that the next time, if there is a pandemic, we can produce the vaccine candidate faster. However, it's not just about the infectious disease or other newly emergent disease or disease X, but we can also produce recombinant protein that can be used for other diseases like monoclonal antibodies for cancer or monoclonal antibodies for other diseases that might not have patients might not have enough access to these medicines. So our facility is a multi-product facility, meaning that we can produce different products from the same technology platform that we have. Also, we have our R&D team working on other projects as well. So we have a progress so far. Our R&D team works on monoclonal antibody for cancers, and we found that the results are really promising. And we try to get it into first in human trial, like maybe next year. So so the answer is yes.
This technology has many potential, right? It can use to cancer treatment, to develop vaccine, and what else that it can do to improve our medical treatment?
Yeah, just like I said, right? Like we can produce medicines for cancer, we can produce medicines for Ebola, we can produce medicine for Nipah. Yeah, our CTO has worked on Ebola vaccines and treatments when she did her PhD thesis. She has been working on rabies treatment, which is still a problem in this region. Many people still die from rabies. So there can be so many other diseases, and we are expanding our R&D team to work on several other projects. For example, we have another team working on lumpy skin disease for infection in cows. That we have another team working on it.
According to Professor Thiravat, new emerging infectious diseases are waiting to come out and wreak havoc in the world. He has revealed that around 50 to 80% of the pathogens found in the patients in Thailand's hospitals are unknown to the medical science community. There is a high risk that these pathogens may kickstart another devastating outbreak yet again in the near future. Fortunately, with the establishment of the Asia's first protein subunit vaccine production plant by Baiya Phytopharm in Thailand, Dr. Suthira assured that Thailand will have greater ability to cope with whatever pandemic that may emerge in the future. Nevertheless, we still have to respect and protect the nature to minimize our risk of unintentionally causing the virus crossover between species from animals to human, as Professor Thiravat has suggested, in helping ensuring a safer future for humanity. Unlock the Science would like to thank Professor Dr. Thiravat Hemachudha of Thai Red Cross Emerging Infectious Diseases Health Science Center, Chulalongkorn Hospital, and Assistant Professor Dr. Suthira, Taychakhoonavudh of Faculty of Pharmaceutical Sciences, Chulalongkorn University, for their invaluable insight on the topic of emerging infectious diseases. Since today's episode is the last episode of the first seasons of Unlock the Science, the show's editor and producer Thiravat will have some final words with our listeners.
Hello, I'm Thiravat, the editor and producer of Unlock the Science. Since today's episode is the last episode of our first season, I would like to take this opportunity to thank all the people helping to make this show possible. First of all, I would like to thank Chulalongkorn University Communication Center, or CCC, for their support, and Chula Radio Plus for helping initiating and facilitating the production of this show, and all the technical and administrative support of the staff of the radio station. Then our small but capable team of reporters, Prat Luchiwanarom and Hawang Mang, and the show host Lawan Chirasuradeh for her narration and contribution in reporting. I myself did some reporting in this show as well. Unlock the Science will continue with its second season in the early month of 2022 with some changes. But we will continue to bring to our listeners the most relevant fields of science, research, and study in Thailand and other countries that affect our daily life and environment. In the meantime, from October 2021 until our next second season starts, we will rerun our show from the first season. Finally, I would like to thank our listener and audience in all platforms, either listening live every Saturday from 1 p.m. to 1:30 p.m. on FM 101.5, or listening through our website curadio.chula.ac.th and our Facebook page Unlock the Science. Every and all episode of our shows can now be accessed through podcast platforms of Apple Podcasts, Spotify, SoundCloud, and Google Podcasts. I hope you will continue listening to our shows. Thank you.
Unlock the Science is edited and produced by Thiravat Hemachudha with Lawan Chirasuradeh as the program host and co-producer.